Good afternoon. I'm hoping to go live with Leah, who works for the Cosmetic Skin Clinic, and we're going to be talking about CoolSculpting. So CoolSculpting is a great treatment if you've got those stubborn areas of fat. Basically, if you can squeeze it, you can freeze it, is the mantra. Leah's going to be joining us. So it's really good. It's for generally fit people, stubborn areas of fat, which they would like dissolved, which are difficult. Hi Leah, how are you?
Hi Adrian, I'm good. How are you?
Very good. Are you working from home?
I am, yes. Have been for the duration of lockdown.
Yeah, and how's that been for you?
It's been really good actually. I've really enjoyed it. I think my productivity levels have definitely increased. I've really enjoyed sort of being at home, so I've enjoyed it.
Yeah, it works well for some people, doesn't it, I think?
Yes, I think it's kind of like Marmite. You either love it or you hate it. I think there's a lot of people raring to get back to the office or either loving working from home, so.
Yeah. Well, I'm glad you've enjoyed it. So today, Leah, you work for the Cosmetic Skin Clinic, and we're going to be talking about CoolSculpting. So, tell me all about it.
So yes, I do work for the Cosmetic Skin Clinic. I am the digital marketing executive there, so I handle all the social media. But my views and feelings towards CoolSculpting are completely my own and completely genuine towards the treatment. I was a massive skeptic at first. I'm really, really active. I'm currently training for the London Marathon, if and when it goes ahead.
Yeah.
It keeps being postponed. But I've always been really active. I train 5-6 times a week, but I always had those stubborn areas that I just could not get rid of. So obviously when I started at Cosmetic Skin Clinic, I was seeing all these before and afters and patient testimonials, and I was thinking, oh, that actually looks really good. So I was given the opportunity to try it and impressed.
Okay, so we don't need details, but how long did it take to work, and did it get rid of the areas completely, and what was the treatment like?
So I had my abdomen and my flanks, which is your sort of your muffin top or love handles, treated. I've kind of got I used to have like a pouch, I used to call it, on my abdomen, and I just could not get rid of it. And so I had the CoolSculpting treatment done. It took a few hours. I had Rhea do it. She was absolutely fantastic. And I started to see results after 3 to 4 weeks after my treatment, but they continued for, I'd say, up to about 12 weeks after I'd had my treatment. It was just getting like flatter and flatter. It was amazing. And then combined with my training, it was literally results that I never thought I would ever think possible.
Yeah, and was that tissue that you couldn't get rid of by all your training, do you think, Leah?
Yes, completely. It was just so stubborn, really stubborn areas of fat. I kind of used to call myself skinny fat. So
Yeah.
I had an okay body, but I just wasn't comfortable in certain types of clothing. My jeans felt tight. And so CoolSculpting really helped me to feel more confident in certain, not even wanting to be confident in a bikini. It was more, that's an added bonus, but for me it was more feeling confident in dresses or jeans and things like that. So that's really helped to get rid of the stubborn areas that my training just wasn't budging.
Okay, and what does it, explain the treatment, what actually happened in those 2 hours you had treatment, Leah?
So Rhea was lovely. I was a bit nervous, but she was absolutely fine. She put my mind completely at ease. She will draw on you first of all, so she can see where she's putting the applicators, and it's like a vacuum, the applicator, and they put it onto the area that's being treated. Like you said at the beginning, if you can squeeze it, you can freeze it. So
Yeah.
they put the area that you want treated into the applicator, and you can feel it kind of pulling in, and then it comes into contact with the cooling plates, but your skin is completely protected with a gel pad, so there's no danger there. And it uses controlled cooling to freeze the fat cells. So you do feel the cold, but it just goes numb after a while. And then I just relaxed. I watched some Netflix. I think I had a bit of a nap as well, so I was quite tired. Rhea was bringing me a cup of tea after a cup of tea and biscuits and stuff like that. So I just relaxed really. And then that's for about 35 minutes. And we can do dual sculpting. So I had 2 areas treated at the same time. And then the applicator comes off after 35 minutes and the area is massaged. So the massage is probably the only part of the treatment that I thought was a little bit uncomfortable, but it was over within 2 minutes and it was completely fine.
And so the dual sculpting, something that the CSC has sort of pioneered, I think, isn't it?
Yes.
So
It is, yes. So it's really amazing that they've got, you know, you can treat so many areas at once. So the CSC definitely did pioneer that, yes. Well, they say that, you know, to maintain the results, they do say that once the fat cells have gone, they're gone for good.
Yeah.
But you just sort of maintain it, and I think you definitely do see, you know, even more superior results if you are maintaining that healthy diet and lifestyle and stuff like that. I certainly did anyway. So I definitely think it does help to have that on your side with it. But they do say once the treated fat cells are gone, they're gone for good.
Yeah, because I think that's right, isn't it, Liv? So you have a certain amount of fat cells, and when they're disrupted, your body dissolves them, so you've got less fat cells to
yes, exactly, which is actually something that I learned. I didn't realize that when you have a certain amount of fat cells, and when you gain weight, you don't increase the amount of fat cells. It's just the existing fat cells getting bigger, and when you lose weight, they get smaller. So what CoolSculpting actually does is it kills the fat cells. So that was really interesting to me when I learned that.
Yeah, so that means you just haven't got the fat cells to
yes, it's exactly right.
And remind me how long it took for you to realise, to notice something was changing.
Well, I mean, I say probably about 3 to 4 weeks. I mean, after the treatment, I was, you know, a little bit tender and a little bit swollen, but nothing sort of untoward. And it was probably about 3 to 4 weeks afterwards that I really noticed, like, oh wow, this is actually working. And I was really impressed. And then over the weeks, it just got better and better.
Yeah, well, that's amazing, isn't it? Great treatment.
Yes.
And if anyone would like to know more about it, how do they sort of find out more about CoolSculpting, Leah?
So if you would like to find out more, we do offer complimentary consultations. CoolSculpting is available in our Stoke Poges, Buckinghamshire and London clinics, but it's also available at Leeds, Manchester and Bristol as well. So if you would like to book a consultation, it's no obligation, it's complimentary. And what you do is you just come into the clinic, speak to one of our CoolSculpting specialists, and you just talk about the areas of concern that you have. They'll have a look at you and determine your treatment plan and, you know, all the budget and things like that. And if you would like to do that, you can just tap the little call button on your profile or the Cosmetic Skin Clinic's profile, and you'll be put through to our reception team, or you can email us and they will book you in.
Brilliant. And who is the ideal person?
The ideal person for CoolSculpting, I would say somebody who has stubborn areas of fat, is probably maybe really active, or, you know, quite active, but just has those areas that, you know, they look in the mirror and think, oh, if that was a bit flatter, if that was a bit tighter, if that was a bit, and you can't get rid of them, I would say that makes you an ideal candidate for CoolSculpting.
Yeah. So not too, you know, with a relatively normal BMI. So relatively, so it's not really a cure for someone who's really big generally. It's a sort of specialised areas, isn't it?
Yes, definitely. And that is why we do encourage you to come in for a complimentary consultation, just so our specialists can see, you know, whether or not you are an ideal candidate, and, you know, have a look at the areas and see whether or not it will work and whether you're an ideal candidate for it.
Yeah, we've got a couple here, Leah, a couple of questions. So I had CoolSculpting, this is from Nalina, for my outer thighs, but it didn't work. I have a free consultation with the Cosmetic Surgeon Clinic tomorrow. Hopefully it will work this time. Does it sometimes not work, Leah?
I mean, it didn't not work for me, and I've not heard anything from anybody else, you know, from that perspective. So, I mean, I can only go from my personal experience, and I'm over the moon with my results. So, but I do know that it's a very bespoke treatment, and sometimes, you know, it's not a one-size-fits-all treatment. So.
Yeah, I think different people react differently, don't they?
Yes, exactly. People do react differently to treatment, so that's always an important thing to consider when you are having a treatment or considering a treatment.
Yeah, and Leah, outside that, so your social media background, what are your main challenges and areas of interest in the social media field?
What, in terms of work or in terms of?
Well, work probably, yeah. What's most effective? What are your most effective channels for reaching people?
I would say Instagram. I really love making content for social media. I find it really interesting. I love gathering the content for it, making the videos. I love looking at before and after pictures, and I find that before and after pictures actually work really well. People love a before and after.
Yeah.
So I would say that Instagram is probably our one of our best channels, and if you go to the link in our bio on our page as well, there's lots of information there about different pages on our website that you can visit to find out more about our different treatments as well.
Yeah. And did you know that at the Aesthetic Awards there's a best result of the year award? Did you see that?
I didn't know that.
No. So there's a best facial surgical and non-surgical.
Okay.
So it might be worth entering that, because I know you've got some great before and afters.
Yes, we do. Oh, that's thank you. I'll have a look into that.
Yeah. So it's, well, the Aesthetic Award. Have you been to the Aesthetic Awards, Leah?
I haven't. No, I haven't. I haven't been lucky enough to yet.
Oh well, maybe this time. But it's definitely, well, if you are nominated for a prize, you have to go, won't you?
Yes.
Well, Leah, thank you very much for telling us all about CoolSculpting. So, it worked really well for you. And you said you were sceptical, weren't you?
I was, only because, I am a very active person. I have a lot of knowledge about calorie deficits and, the best way to lose fat. And I know that you can't spot reduce. And I was very skeptical, and I thought, this is just not going to work.
Yeah.
But I was pleasantly surprised, and I was proven wrong. So,
yeah,
as I think a lot of people are with CoolSculpting.
Yeah, and would you ever have it again, or are you just happy with the bits you've had done, and that's sorted, resolved?
Yeah. Oh, they say that once you've had it, you become a bit of an addict to it. I would definitely have it done again, definitely. So, and I definitely would go back to Cosmetic Skin Clinic, have it done there with Ria or Magda, because they are fantastic at what they do, and you know that you're going to get a good result because they just really look after you.
Yeah, and that's what they do all day, isn't it? They really do.
Yes. I mean, Cosmetic Skin Clinic have performed over 20,000 CoolSculpting treatments to date, which is just insane. So there's a reason why they're the #1 CoolSculpting clinic in the UK. So
yeah, so go to the best.
Yes, exactly that. Yeah.
Well, all right. Well, lovely to see you. Really nice to see you. And I hope the rest of the lockdown isn't too bad, and hope to see you again in person soon.
Lovely. Thank you, Adrian.
Yeah. See you soon.
Thank you. Bye.
Bye, Leah. Bye.